It's a good news and no news sort of day coming out of Queen's Park this afternoon. Earlier today, the Premier announced that he would be making a wage increase permanent for some frontline healthcare workers. But if you were looking for an update on what will be happening with your child's school come September, well, no such luck.
We gave him a $3 an hour bump in pay. We're going to make sure we make that 100%. I know it was temporary, but they're going to have a $3 increase in pay. We're going to keep that in place.
It's the kind of pay increase personal support workers, or PSWs, have been calling for years. Back in October, the Ford government announced the pandemic pay boost for PSWs in long-term care homes, community centers, hospitals, and those caring for children. The bump was supposed to be temporary, but has been extended twice. This announcement means it will continue beyond August, acting also as a lure for those considering the work.
We're also investing $4.9 billion over 4 years to create more than 27,000 new positions for personal support workers and nurses.
And while that's creating some level of financial certainty for PSWs, teachers, parents, and students still don't know what next year holds.
We have been working on our back to school program for September for many months with Dr. Williams, the former Chief Medical Officer of Health, and actively with Dr. Moore, the current Chief Medical Officer of Health, with one aim, which is to return all children back into class full-time, in person.
But what does September look like? The Minister of Education doesn't know.
We will be sharing final guidance with the ministry in the coming weeks. We will provide that to parents with the intention of restoring extracurriculars, sports, clubs, and a more social, interactive, yet continuing to be safe learning experience.
But Karen Littlewood, the new president of the Ontario Secondary School Teachers Federation, says she's concerned the coming school year will have many of the same problems as the last.
Last summer was incredibly late to find out in August what the plans were going to be. Again, like this is we're going down the same path that we did last time, where parents are worried, where the staff are worried, where people don't know what they're going to be walking back into.
Lecce says school ventilation systems have been improved, but acknowledges work still needs to be done. He points to the accelerated second doses for youth and climbing vaccination rates as positive signs of school safety. But school buses, extracurricular activities, and even class sizes have yet to be determined.
We want to make sure everything's in place to be as safe as possible and every precaution is taken. So if that means smaller class sizes, then that's what we need, is smaller class sizes. I think I can sit with 6 people now on a patio, or 5 other people, but I could have 35 kids in a classroom together eating lunch. So, there's just a whole lot of contradictions in what's possible.
Now, as of this morning, nearly or just over 58% of youth aged 12 to 17 have received their first dose of vaccination, and nearly 10% are fully vaccinated.